Minash-shaytanir-rajim. Bismillahir-rahmanir-rahim. In this video, we are going to explain the anatomy of clavicle. Clavicle, which is also called the beauty bone or collarbone, it is located just below the neck, and it is a typical long bone. Means it has two ends or two heads and one shaft. It should be noted that this is the only long bone of the body which is placed in horizontal direction, which is placed horizontally. The rest of long bones in the body are located vertically. Further, it is the first bone of the body which begins ossification after the fetal life. If we talk about the anatomy of clavicle, so it has two ends. The first one, this is the medial end and this is the lateral end. Medially, it articulates with the sternum and the upper part of the sternum, which is called manubrium. So medially, it articulates with the manubrium of sternum, and the joint which is formed here is called Sternoclavicular Joint because it is between the sternum and the clavicle. This joint is a special type of synovial joint because it contains a disc which is called articular disc between the cartilage of clavicle and that of the sternum. There is an articular disc. So this is a special type of joint. Laterally, it articulates with the acromion of scapula. In the previous video, we discussed the acromion in the scapula. So this, which is the lateral head, articulates with the acromion, and the joint which is formed here is called Acromioclavicular Joint because it is between the acromion of scapula and the clavicle. If we talk about the shaft, so first of all, the shaft is curved. It is bulged out toward the anterior at medially, and laterally it is bulged out toward the posterior. So this is the convex surface. It is the convex side, and this is the concave. Medially it is convex and laterally it is concave. If we divide the clavicle into three parts, so this is one part, this is second, and this is the third. The medial two-third part of the clavicle is quadrilateral, means it has four sides. It is just slightly cylindrical, and the lateral one-third is a little bit flattened. So it has two surfaces and two borders, while medially it has four surfaces. Further, in this diagram what you see, this is the superior view. If we look at the clavicle from above, so it would look like this. This is the superior surface, the inferior surface is below it, and it is shown in this diagram. This is the anterior border, and this one is the posterior border. This is the border which is toward the back side of the body. So it is the posterior border, and this is toward the front of the body. So this border is the anterior border. But in this diagram, because we are looking at the clavicle from downward side, if we rotate this by 180 degree, so we would see the clavicle inferior surface. This is the inferior surface, and now the border, this border is the anterior, and this one is the posterior border because we rotated it by 180 degree. This is the inferior surface, the downward surface, and this border is the anterior border. This is toward the front of the body, and this border is toward the back of the body. So this is the posterior border. On the inferior surface, you can see there is an oval-shaped depression to which the costoclavicular ligament is attached. The costoclavicular ligament is between the clavicle and between the first rib, which is called costoclavicular ligament. This ligament attaches the clavicle to the ribs, and it is between the first rib and the clavicle. This ligament is called costoclavicular ligament. We know that ligament is between two bones, ligament is the attachment between two bones. So this ligament attaches the clavicle to the first bone. On the lateral side there is a ridge. You can see this is a ridge and an elevation. This is called trapezoid ridge, and this is called the conoid tubercle or elevation. To both of these, the coracoclavicular ligaments are attached. So you already know from the ligament that it joins or attaches the clavicle with the coracoid process of scapula. Further, if we talk about the muscles which are attached here, so on the anterior surface there are muscles attached. The first one is pectoralis major. Pectoralis major, which is the pectoral muscle, which is toward the front side. This is the attachment side for the clavicular head of pectoralis major. Here on the superior surface, sternocleidomastoid muscle is also attached. The sternocleidomastoid muscle is attached to the back side of head, and it originates from the back side of head and attached to the clavicle. Further, there is a deltoid muscle and anterior border. Deltoid muscle is attached, which is the main shoulder muscle, the superior superficial shoulder muscle, and the posterior border trapezius muscle is attached. Pectoralis major muscle, which we discussed here toward the anterior side. So this is the anterior border. Pectoralis major is attached medially and deltoid is attached laterally. Subclavius muscle is also attached. It is below the clavicle, so that's why it is called subclavius. This is the subclavius muscle on the inferior side of the clavicle. On the inferior surface of the clavicle is subclavius attached. So it was all about the clavicle. Hope the video was helpful. Thank you for watching. Allah Hafiz.